3.
Hi everyone, thanks for joining us today. We're here with Dr. Lee to answer some questions that you all submitted about liposuction, so let's get started. Our first question is, what are the most popular areas?
Well, liposuction is pretty popular in a lot of areas. The most common is going to be the belly, especially the lower belly. So below the belly button tends to be a troublesome spot for a lot of people. And sometimes the upper belly as well, so the inter-abdomen. Also common are the hips and flanks, so the sides, and the flanks even extend around to the back rolls a little bit. And in men, what they call the love handles would include that area.
Okay.
So for men, that's really popular as well. Then for women, sometimes also the thighs, inner thighs, outer thighs.
Awesome, good to know. All right, and next question, what is the recovery time post liposuction?
And that depends how many areas and how extensive the liposuction is. The liposuction varies tremendously. It may be just a small, troublesome spot that really doesn't take very long to do, and there's not very much fat to get. And that person will probably be up moving around in a day or so and back to work and really active. But on the flip side, a person is having multiple areas and maybe even many liters liposuction is going to be at home for pretty much a week, sore, maybe legs propped up and, walking around some, but resting a lot. So it does vary, but I would say average, you're probably up walking around and moving around in a couple of days.
Okay, awesome. And what will liposuction tighten the skin?
That is a loaded question.
Yeah.
So if your skin has decent elasticity, the collagen's in decent shape, after liposuction, you will get some tightening of the skin.
Okay.
However, people who have poor elasticity, maybe if the skin's a little droopy to start with, or really thin, or a little hanging, it's not going to be good enough to really tighten the skin.
Okay.
So yeah, it does depend on the skin. The younger you are, the more tightening you're going to have. The older you are, the more sun damage you have, the more weight fluctuations or pregnancies or anything that decreases your elasticity, the less tightening you're going to get.
Gotcha. All right. And then, what is the best body type for liposuction?
Well, really the ideal candidate is not obese or overweight, but just does everything that he or she can with diet and exercise, but has just a few problem areas that may be fatty deposits that are too stubborn to go away. So that's the ideal candidate. So a fairly normal weighted individual who can't lose in a certain spot is the most ideal candidate.
Okay, awesome. And do you have to have anesthesia for liposuction?
You don't have to. Liposuction is done with local anesthesia, regardless if you have anything supplemental. So the area that you're having suctioned is always numbed with local. Most of the time, we also do other types of anesthesia like IV sedation, occasionally general, but usually IV sedation. And I think most patients are more comfortable with sedation, but if you're not doing too extensive an area, we can do it under local.
All right. And then moving on, how long do you have to wear compression garments post liposuction?
Okay, that's a good question. That is one requirement with liposuction, is that we do have patients wear compression garments for 6 weeks after liposuction.
Okay.
And the compression garments aren't as bad as you think because they're underneath your clothes. In fact, some people end up liking them and not wanting to get rid of them in 6 weeks, but they control the swelling and help compress the skin. Now, if you're having liposuction in the neck, which we have not mentioned yet, but we call that submental liposuction. So this area here, we only have you wear a compression for 2 weeks. So that's the exception.
Gotcha. Okay. And then our last question today, does liposuction need drains?
No, I do not use drains if it's only liposuction.
Okay.
And Sometimes patients for the first 24 hours will drain out the little tiny holes that we make to do the liposuction in, and so some drainage will come out, but I don't use the drainage tubes.
Awesome. Well, great
Yeah.
to know. We appreciate everyone submitting your questions for Dr. Lee. Thank you for taking a minute today, and thanks for tuning in. Have a
Yes,
good
thank
one.
you. Thanks for sending in questions.